may begin.
1 in 235. This is the number of children that will be diagnosed with cancer before the age of 20, according to the American Cancer Society. This year, over 16,000 new cases of cancer will be diagnosed in children and adolescents. As a young girl, I watched as my Nana fought a courageous battle against cancer, witnessing firsthand the toll that this disease and treatment option has on a patient and their families. Since this time, I have focused my attention and goals on impacting those stricken with cancer, making sure that the quality of treatment in their lives are better. As a result of this desire, my top 3 job choices for a while were a medical oncologist, a doctor who works with the chemo side of the treatment, an oncologist, a doctor who works with adults and children who have been diagnosed with cancer, and a pediatric hematology oncologist. The job that I chose to pursue is a pediatric hematology oncologist. We are doctors who spend years perfecting cancer and blood disorders for children. What exactly is a pediatric hematology oncologist, one might ask? A pediatric hematology oncologist is a doctor who specializes in using medicine to treat kids with cancer. The hematology aspect of my job description is a doctor who specializes in the diagnosis, prevention, and treatment of blood disorders. Some of the common sicknesses that I will be working with are sickle cell diseases, hemolytic anemias, hemophilia, acute lymphoblastic leukemia, von Willebrand disease, and embryonal tumors. The treatment options that I will choose for children are based off the type and stage of their cancer. Treatment options include surgery, radiation therapy, and chemotherapy. There are more treatment options out there, but every treatment plan includes one of those as a building block. Since I studied hematology, there will also be other treatment options out there for kids who have a blood disorder. The first one is biological therapy for benign and malignant blood disorders, chemotherapy, growth factor drugs, immune suppressive drugs, chemotherapy, and stem cell and bone marrow transplantations. Being a pediatric hematology oncologist means working cooperatively in teams to make sure that our patient gets the best care. Within those teams are a pediatric oncologist, pediatric surgeon, pediatric oncology nurse, nurse practitioners, and radiation oncologists. Since I also studied hematology, I will have another team, and within that team is a medical oncologist, a radiation oncologist, and a transplantation. Opportunity cost is when you give up one thing to pursue another. Giving up something in life is always hard. I gave up being able to become a medical oncologist because I wanted to work with children. I also gave up being able to become an oncologist because I could not handle seeing the elderly in pain because it brought back too many memories. The last thing I gave up was living close to home because I wanted to work in an environment that gave me better opportunities to see different types of cancer. In a job that deals with helping children, there are going to be some positive incentives. The first one is being with children all day. The second positive is helping children get better because my mission as a doctor is to look a child in the eye and tell them that he can run and jump and swim because he doesn't have cancer or a blood disorder holding him back. The last positive incentive is me being able to become a leader of a team because my personality is that I like to be in control and make sure that everything is done to the best of its ability. While there are positive incentives, there are also negative. The first negative is when I see one of my patients in pain, and the second negative is when I have to tell a patient's parent that their child either died or only has a couple of months to live. The last negative incentive is when I have a patient's parent mad at me because there isn't anything that I can do for their child but give them something so they don't die in too much pain. One major positive about my job is that my annual income is $201,000. My monthly paycheck is $16,750, which covers housing, transportation, utilities, taxes, food, school loans, toiletries, and discretionary. My housing takes up about 15% of my monthly budget because my apartment costs $2,545. Transportation takes about 4% of my monthly budget because my car payment is $277.75. Utilities take up 1% of my monthly budget, mostly because my rent covers utilities mostly. The biggest chunk of my paycheck goes to paying my taxes, which are 37%, mostly because my federal income tax is $4,120.36. For food, I pay $400 a month, which takes 2% of my monthly budget. School loans allowance take up 15% of my monthly budget because I pay $2,450 a month, which instead of paying my school loans off in 20 years, I will be able to pay them off in 11 years and 8 months. The last thing in my budget is discretionaries. Discretionaries take about 24% of my monthly budget with a total of $4,122.26. My trade-offs are giving money in my savings account so I can buy books and go to the conferences that I need to attend. My second trade-off is me not getting a dog because the apartment that I wanted did not allow pets. The last trade-off is me not flying home to see my parents as often because I need to pay my school loans. I chose to attend Oral Roberts University while majoring in biomedical chemistry. After attending the normal 4 years of college, I attended Johns Hopkins School of Medicine for another 4 years. It was in my last year that I was a student senate president, and after that I entered a 3-year pediatric residency, and it was in my last year that my advisor told me that I was accepted into the oncology/hematology department fellowship at Johns Hopkins for another 3 years. It was in between my residency and fellowship that I went to Costa Rica to volunteer as a healthcare worker. I moved to Seattle, Washington because of the exceptional success that their oncology department has displayed. Their unusual track record and progress vision is what made me want a position in their pediatric oncology staff. I'll also consult with the hematology department. I listed as my references John Kimmel and Joel Gatwick, both of them being my professors. I was interviewed by Dr. Shepard, who is the head chief of Seattle Grace. The 5 major websites that I used for my paper was Bolt Apartment to find my apartment, Hopkins Medicine, which is Johns Hopkins' home website, to find if I had the right major to get into school and how much school cost, ORU.edu, which is Oral Roberts' home website, to see if they had the right major for me and how much school cost. I went on cancer.org, which is American Cancer Society, and I found a great article that describes childhood cancers and how they're treated. And the last article that I read was from ASPA.org, which is abbreviated for the American Cancer Society of Pediatric Hematology/Oncology, and it was an article about the progress that we've made throughout the years. For some, the mere thought of spending 14 years in college to pursue a dream is inconceivable. However, to me, this is but a brief span in my lifelong journey to help make the world a better place, assisting those that are battling with the disease that took my Nana's life too soon. While I know that this will not be an easy trek, Usain Bolt once said, "Don't think about the starter race, think about the ending." While I know that this is going to take a long time, what motivates me is ending cancer in children, easing their pain and suffering, while knowing that my Nana is smiling down at me from heaven.